Well, keeping an eye on your health now, the FDA recently announced plans to update blood donation guidelines. The original long-standing policy excluded most gay and bisexual men from giving blood. This new guidance would change that. So joining us to talk about the changes is Dr. Michael Tees with the Colorado Blood Cancer Institute. We really appreciate your time today. Thank you.
Well, thank you for having me. I appreciate it.
Tell us about this new guidance and how it could change blood donor eligibility.
Yeah. So early on in the AIDS pandemic, there were exclusions that were put in place that ended up becoming permanent due to the concerns and risk of transmission of HIV to unsuspecting individuals who needed blood and platelet transfusions for their medical procedures. Time changed, and that policy did not. And over the past 10 years, there's been more and more evidence that has supported that risk is simply not there, like it was early on in the AIDS pandemic. And so, about 10 years ago, the FDA put together a large panel that included many different folks and individuals from different aspects of the government to kind of move this forward. And, things take some time, of course, and eventually using evidence, they made some kind of preliminary recommendations that are now moving forward, thankfully, that will now allow more donors who donate the gift of life, the things that we all need to do what we do for patient care.
Yeah, big change for the industry. What could this mean for the nation's blood supply?
Yeah, I mean, ideally, it will increase the blood supply. If there's more donors that will not be deferred due to their simply their sexual orientation, I think that will open up the supply of potentially thousands of more potential donors that have always been willing to donate, yet were deferred due to the restrictions that were in place.
You kind of touched on this, but why make the change now? Was there something that prompted the FDA to revisit that old guidance?
Well, I mean, data, numbers, and really, I believe a public push for this. This is inherently on paper, it appears to be a discrimination. It is not. There was evidence to support why it needed to be done 40 years ago, when 1 in 2,000 blood products could increase the risk of transmission of HIV, where now it's 1 in 2 million. That risk simply doesn't exist anymore.
So someone who's watching this right now thinking, I haven't given blood in a while, what's your pitch to someone who might be on the fence or has never tried it?
Do it. Yeah, give blood. It helps. It allows us to treat the patients who need to be treated for their blood and their blood cancers and blood disorders. It allows patients who get into a car accident in a trauma-like situation to get the products they need to survive. That allows patients to get through surgeries when they need to get certain procedures done. Please log in to Vitalant.org or reach out to our website, bloodcancerinstitute.com.org, and we'll be able to provide some guidance on where you can go donate.
I love it. Just do it. All right, Dr. Tees, thanks so much. We appreciate it.
Thank you for having me.